So one of the problems with depression is that we don't have any biomarkers that are going to, or blood tests, for example, that are going to tell us exactly who's going to respond in which way to which drug. And that makes it a bit different from other diseases, disorders. And there's some interesting work going on looking at whether certain sorts of brain scans can predict who's going to respond to which drug, but my perspective on that is that it's always more likely to be cheaper to try the person on the drug than to put them through a brain scan to decide whether or not to have the drug. That's sort of interesting from an academic point of view, but from sort of clinical parameters that might help us decide which people to try rapidly acting antidepressants, that is really, really tricky. We think that elderly people are slightly less likely to respond, or they need longer or higher doses, but we're right at the beginning of very, very early stage here, so I think that the jury is very much out on that. And that's another reason for monitoring people, is to try and identify these subgroups who respond and who have side effects sooner rather than later. So a big issue about rapidly acting antidepressants is going to be access. I think it's going to require us to change how we think about administration of antidepressants, not least because the rapidly acting antidepressants tend to be administered sort of once a week or once a fortnight, rather than on a daily basis, and they're likely to be administered in a clinic setting rather than by the patient at home. One of the problems with that is that obviously the more difficult it is for patients to access in one setting, the more likely they are to go to another setting. So if, for example, it was difficult to access in the NHS, people might then move to a private setting or even to illegal use, and obviously the illegal availability of ketamine means that this is possible, and for this reason I think it's really crucial that we try to make accessibility as good as possible. That also means that we're going to have quite a lot of people who are going to want to be assessed to have ketamine or some other rapidly acting antidepressant who are not going to be suitable for it. It's going to create work, and it's going to create disappointment as well. That's all going to need managing.